All right, Mr. Smith, now I'm going to go ahead and explain to you what's going on with your back and leg pain. Between your vertebrae or backbones are a series of discs which are very thick and durable structures that act like a cushion type of shock absorber in your back. If these nerves get caught between your vertebrae or even moved or compressed by one of these discs that I was just talking about, the resulting signal of that nerve being compressed is pain in the areas that the nerve works at, and which is why you're experiencing that pain in your back and your leg. This is why the manual treatment we performed earlier in the appointment helped increase your ability to bend forward, because the nerve is being compressed less now after I moved your vertebrae a little bit, which is why you also only felt an increase in your back pain and not your leg pain when bending forward the second time, because the pain is starting to become more centralized in your back rather than going all the way down your leg. And although that may seem bad, it is actually good, because then we can start to focus on that one spot. Kind of like when you are trying to get sand off you after the beach, and it's better to have sand just in one spot rather than sand all over your body when you're trying to get it off you. The healing time for this injury is around a month to 2 months, so I want you to come in twice a week for 8 weeks. PT will help this injury by helping to get that disc back into place, as well as strengthen your muscles and work on the mobility in your back so the disc is less inflamed, which will lead to the nerve being less irritated. Because of the nature of your job, being a truck driver and all, and being seated for long periods of time, I recommend you adjust your seat and move around a little bit while you're driving so that you're not leaning forward at the hip so much, as well as taking breaks whenever you get the chance to, and get out of the truck and do some back extensions, which I'll get to later on in this appointment, and I'll teach you how to do those. When coming into PT, we will most likely do some exercises to help with the strength and range of motion of your back, as well as manual therapy techniques we tried earlier in this appointment. Because you will be exercising, you might experience some soreness after your visits and possibly into the next day. Soreness is okay though. If you feel like your injury has flared up and gone down to your legs again, and it isn't the pain becoming more central, or it's not soreness, please let me know at the start of the next appointment I see you, and I will make adjustments to the plan of care accordingly. Some exercises I want you to do at home, or when you can, when you're on the road, or standing back extensions, which is similar to what we did earlier this appointment. But now we're going to try to do 2 sets of 10, 2 times a day. What you're going to do is you're going to take your hands, put them on your hips, and then you're just going to kind of extend back like that. So extend, hold it for a second, and then come back. And like I said, we're going to do it twice a day, 2 sets of 10. The second exercise I want you to do is I want you to lay down on a table or a bed, probably a bed, and I want you to bring your hands to your chest level like this, and then what I want you to do is just to push up with your hands and only bring your back upwards like that. And same thing, you're going to come up, you're going to hold it for a second or two, and then you're going to come back down. And like the other exercise, we're going to do 2 sets of 10 of that as well. All right, do you understand the 2 exercises I've explained and shown you? All right, awesome. I will also print you a handout at the end of this appointment that will have a description and a picture for each of the exercises as well. Throughout the next couple of days until you see me next, please take mental note of how you're feeling and whether or not the exercises I've given you are helping or not. If anything comes up, feel free to call the clinic and ask for me depending on if it's a busy day or not. They will either take a message at the front desk and I will get back to you as soon as possible, or I will be with you right away if it's not busy. Alrighty, do you have any other questions or concerns? Okay, yeah, it's totally understandable to be frustrated with having back pain at the age you are, but it is actually very common for people around your age. And as a matter of fact, 35 to 40 years old is the most frequent time that this injury happens. Yeah, it's crazy. Do you have any other concerns? Yeah, it is possible that this injury can happen again, but if it does, I will make adjustments to the treatment plan. But if you stay pretty dedicated to the HEP or the exercise program I gave you and the treatment that we are doing here in the clinic, I think the chances of recurrence will be a lot lower. And overall, I think we're going to do good here, and we're going to get better. Do you have any other questions or concerns? I have the time. Just let me know. Alrighty, well, I'll walk you to the scheduler out front and she'll get you all set. Have a wonderful rest of your day, and I'll see you next time.